Hi everyone, Dietitian Talk with Annie and Sydney. Question of the day is about caffeine. So there was a little misunderstanding about caffeine. Decaf caffeine products are fine during any part of the process. In trace amounts, it's not going to cause as much of an issue, but caffeine can be a little bit irritating to the gut and can cause a little bit of a tummy ache, which is why you want to avoid it up until that first month or so post-op.
We also want to avoid it a little bit at the beginning as well, because caffeine is dehydrating and you may not be getting in all your fluids at that month mark or even that 2-month mark. So we don't want that caffeine to replace the fluids that you could be getting. So that's why everyone kind of adds it in a little bit differently. And then one other thing with caffeine or even decaf, it is going to be acidic, so we don't want to just drink it all day long. And a little bit too much coffee isn't the best for us.
Yeah, so 1 to 2 cups a day or so or less is permissible. Permissible to try after 1 month, but it might be wiser to wait till 2 months depending on how much fluid you're getting in.
Exactly.
Yeah, so.
And if you have any other questions, you can always contact us. All right, thanks.
Who doesn't love a nice cup of Joe? For many, we feel we can't even start our day without it. But unfortunately for bariatric patients, it is very important you refrain from consuming caffeine after surgery. So why is this important? In short, hydration. Post-bariatric surgery, it is very difficult to consume the recommended amount due to the invasive nature of the procedure. As a matter of fact, dehydration is the most common reason for readmission to the hospital post-bariatric surgery. With that being said, caffeine is a diuretic. If you are not getting enough fluids and you add a diuretic to the mix, you're gonna increase the risk of dehydration. So here's the good news. You can drink coffee again, and it can be sooner than you think. When you can comfortably drink 64 ounces of water a day consistently, then you can include caffeine. So that's it. I'll see you guys in the next.
Hi everyone, I'm Nina. Welcome to the Mexicali Bariatric Center YouTube channel. Today I would like to talk to you about coffee. I get asked a lot, will I be able to drink coffee after my surgery? And the answer is yes, you can, but not right after surgery. And here's the reasons why. 2 reasons actually. The first one is that coffee has caffeine. And as you know, caffeine is a diuretic. So right after surgery, remember that our main concern is making sure that you don't get dehydrated. Getting all your liquids in daily is very important. So when you were trying to do that and you're drinking coffee, you're kind of working against what we're trying to do. So that first thing. The second thing that coffee has going against it in regards to bariatric surgery is that it makes your stomach produce more acid. Now, as many of you know, with the gastric sleeve, for example, one of the quote-unquote side effects is acid reflux. So, in fact, with all surgeries we do except the lap band, for the first 3 months, we'll ask you to take acid inhibitors. We're trying to regulate the amount of acid production in your stomach. So, if we're trying to do that with medication and you're drinking coffee, again, you're going against what we're trying to do. So it doesn't mean you won't be able to have coffee, it just means not right after surgery. So our recommendation at Mexicali Bariatric Center is to wait 3 months. After 3 months, you can start introducing coffee into your daily routine. Just 2 things, moderation in quantity. Don't start with 6 cups of coffee a day. I mean, start with a cup a day and see how that goes. If you start experiencing any negative effects, stomach aches or nausea or something like that, stop. And another thing is be really careful what you put in your coffee. Sometimes I get calls and say, well, my has stalled. And when we go over what has changed, they're stopping by the coffee shop, they're adding flavorings, sugar, cream, all this stuff. When you check, it's actually close to 600 calories a day in just 1 drink. So it really, it doesn't make sense. You're cutting portions of food and then drinking it all in your coffee. So those 2 things to take into consideration. Of course, enjoy your coffee in moderation. I hope this helps, and I hope to see you soon. Bye-bye.
Hello everyone, I'm Dr. Alvarez with endobariatric.com and welcome to another episode of our FAQ section. And today, yes indeed, a very common, very frequently asked question, we will be talking about coffee. Coffee after surgery. This is very important, and we can surely or briefly talk about coffee before surgery. Can you have it? Yes, not a problem. But after surgery, can you have it? And the answer is yes, but when? All right, because you can't have coffee, regular coffee. Caffeine is the issue. Caffeine right after surgery, because caffeine, the molecule of caffeine, is very irritating. It irritates the inner layer of the stomach, which is something we don't want right after, since we're healing, we just have had surgery. It's so swollen, it's on fire, that we want to put that fire out, and caffeine right away will not help. It will go the other way, which is what we don't want. So staying away from coffee at least 7 days of caffeine, the first 7 days, is a good idea. Can you do decaf coffee right away, right after surgery? The answer is yes. We use that in our practice. We give the go with decaf coffee right away from week 1, and we wait for regular coffee for week 2. You might want to touch base with your own doctor's guidelines, since this may vary. This is what we've worked with years. We've been close to 20 years doing sleeves, and this is what we've seen that works very good for our patients. So very important, stay away from caffeine in general, not just coffee, the first 7 days, and then you can resume regular coffee and touch base with your doctor. All right, I'm Dr. Alvarez with Endo.com, where we are changing lives one sleeve at a time. If you enjoyed the content, leave me one of this. Thank you very much.
Hi everyone, my name is Sherry. I'm your bariatric nutritionist. And should you be drinking coffee after surgery? The answer is no, but maybe, because if you have a lot of reflux after surgery, it's going to be a really bad idea that you're drinking coffee after surgery. Also, coffee is very dehydrating. This is my best suggestion, to wait a few weeks after surgery until you're getting your liquids in, until you're sure you're not going to be dehydrated before you add caffeine. If you drink coffee and you have acid reflux, refrain from drinking coffee again. If you want more information like this, click on the links below.